Upstate knew that we needed a better relationship with our neighbors, specifically our neighbors in Pioneer Homes in Syracuse housing. We identified through a health assessment that cancer was a concern among the residents, and specifically breast cancer rated pretty high on the list of concerns for women in Pioneer Homes. So we knew that we had to do something to address those concerns, being the academic medical university in the region.
We currently have over 600 women in the program, and we screen over 100 a year. We have 6 RHAs, the resident health advocates, that do our peer-to-peer education, and we are in 8 different housing units across Syracuse.
She Matters works in this particular community because we're serving an underserved population. This is a group of women that may not ordinarily go to the doctor or enter healthcare by ordinary means. There's a lot of resources through this program that doesn't simply include getting a mammogram. So if you come to us and you don't have health insurance and you haven't been to a doctor in ages or you don't even have one, the first thing they'll do is help you with applying for health insurance, which you'll probably be eligible for and get, and then connect you with a primary care doctor or connect you with another specialist if you need it. So it's kind of like an entryway into the healthcare system in general.
We have our Upstate health professionals educating women in the community, and the peers act as advocates. They're people who live and work in the area they serve. And in terms of She Matters, they're educated in breast cancer risks, screening, awareness issues, anything that has to do with breast cancer and how to detect it early or prevent it.
We've noticed some behavior change with the women. It's actually 33% within the last year have come to us knowing when they're due for their appointment and asking us to schedule it for them before we call them and let them know that they're due. We're educating them on more than just screenings. We're talking to them about overall health, their nutrition, their exercise, how this all can impact cancer.
If a She Matters participant tests positive for breast cancer, we immediately enroll them in our multidisciplinary comprehensive breast cancer care program. Doctors of all the different specialties get together and make a plan of care for that particular patient. A breast cancer navigator will then follow them through their course of therapy and be their point of contact. We have every ancillary service for the patients as well, right here in the Upstate Cancer Center.
Mammogram parties happen twice a month, the first Thursday of the month and the third Saturday of the month at our Women's Imaging Center here at Upstate. Over time, our mammogram parties have turned into more of a social club. People come for their appointment and often they sit and they hang out, they have a cup of coffee, they talk with us.
The reason I got into the program because I found out that I had breast cancer. This program was very vital to me. They took care of me, and today I'm 5-year survivor.
It's been my great privilege to work with our wonderful team of outreach leaders and coordinators, as well as to get to know our resident health advocates who are an integral part of this team and the reason that this program is successful.
She Matters means saving people's lives, detecting early breast cancer.
She matters because it's a group of women supporting other women to take care of their health and empower them to come and get their mammogram every year.
She Matters has been successful over the last 6 years, but we can be more successful if we could expand into other areas and reach more people.
She Matters because we know that there are disparities in survival of cancer and many other diseases in minority communities, and Syracuse is a city that has the highest concentration of poverty among people of color in an urban environment, and we want to correct that.